It's obviously not business as usual. So I want to give you some pearls that I think you might want to use as your launching pad for not just when the day comes that we're back to normal, because it'll take some time. There's 7 things we're going to suggest to you that you look at as being critical issues. Obviously, retaining your staff and giving them some chores. We'll call them housekeeping chores. Mailing lists, we talked about that, but we didn't mention about refining those mailing lists so that they, in fact, are targeted to people with specific interests and specific concerns. Website content, we talked about that. Secondly, training your staff is a broad topic, but let's talk about specific areas of training. Communication skills. Everybody's not as comfortable making cold calls to patients. I mean, the howdy doodies, how you doing? We're concerned about you. But right now, this is a lonely period for a lot of people at home that will receive a phone call that want to chat with you and talk with you. Just be careful not to come off as a sales call. Make it a call of concern. These are things we can do right now to help patients get through this very difficult period. Let's call it paying forward. Next, let's come up with some patient incentives when appropriate. You're talking to a patient, they're giving you the story about how wonderful they feel about the services that they've been provided. Say, hey, Mary, if you would make a referral for us, we would very much appreciate it. And for that, you can fill in the blank. Webinars should be targeted to specific types of people and specific needs. If you have people that you can separate into body interest, send them information just on that topic. You can do that maybe weekly, and they would at this time, and they'll be happy to hear from you. Facial procedures, fillers, and so forth. Give them something frequently. Don't let them drift away, as Yvette has alluded to. Now, here's one that's going to be probably provocative. Prospective patient webinars using print and advertising medium. In fact, maybe even use PPC, pay per click. Think about it. People want information, they're searching and so forth. If your name pops up and you've got something going on, or scheduled events coming on, PPC advertising, it makes sense. You're qualifying people, they're looking for something. This is a great time to do things that we probably could never ever do again because of everybody being at home. So in brief, you want to take on a proactive stance. Now, all of these things, by the way, we do, and all these things others do. We'd like to have you call on us about how we would help you get these things done.